أسعد الله مساءكم. زي ما اتفقنا اليوم we will start kind of series that we've already started before, which is simply putting we'll discuss the medical interviews. حيكون معانا دكتور مرزوقة. She is an SHO in London at the moment في ال Department of Surgery. وطبعا أنا معاكم تامر نخال. and I will be talking about various ways of getting an interview in the right place. كتير مؤخرا من الشباب من الصبايا من الدكاترة they've asked me about interviews, and of course given the fact that interviews are coming up بالذات for those who applied for core medical training, core surgical training, أو حتى for any other training, then we will be discussing these things with Dr. Marzuka. I will add our structure will be simply putting حنتكلم عن 5 خصائص للinterviews. يسعد مساكي دكتورة مرزوقة.
مرحبا.
مرحبتين، كيف الحال؟ إن شاء الله بخير وأهل لندن بخير.
تمام، لندن منيحة، بتسلم على الكل.
الله يسعدك يا رب ويحميكم جميعا. Hopefully this pandemic will be over soon with the vaccination. Did you get vaccinated?
إن شاء الله. I did. I got my first dose لسه كمان أسبوعين الدوز الثانية.
I see. يلا على خير إن شاء الله، بالسلامة للجميع. طبعا أهلنا وبلادنا وأهلنا هون كمان نفس الإشي. Hopefully this pandemic will be over soon and we will go back to our a new life. So I hope that this year will be a happy new year, inshallah.
Inshallah.
So I already introduced you to the audience. Dr. Marzuka is SHO in general surgery in London. I am a general and vascular registrar in the East Midlands. And we will be discussing, simply putting, how to structure your mind around various interviews, of course. سواء كان core medical interview, research interview, fellowship interviews, whatever interviews. And we've discussed kind of together before ايش هي الاشياء اللي we have to kind of think around, and we said first we describe it as 5 points في الانترفيو. اول حاجه اول ما يشوفك الانترفيور he will ask about tell us about yourself, something about you. So how would you structure this, Dr. Marzuka?
أنا اللي بطريقة بفكر فيها بهاي الناحية إنه نقسم الموضوع ل4 أجزاء. أول إشي نبلش في الباست، نحكي إيش إحنا سوينا already، إمتى تخرجنا من الجامعة، وين سوينا الامتياز، وين اشتغلنا بعد الامتياز إذا اشتغلت بعد الامتياز. بعدين بنبلش بالبريزنت، هلا إيش الواحد بيسوي، إذا مثلا تشتغل في جوب تحكي إيش الجوب، إيش السبيشالتي، إيش بالضبط اللي بتسوي بالجوب. إذا ما بتشتغل مثلا بتدرس الامتحان تحكي بدرس الامتحان هذا، الامتحان هذا راح يساعدني عشان أسوي هذا الإشي. إذا لا ما تحكي إنه like I'm not doing anything, just say I'm studying to be better at this thing, I'm studying to be better at that thing. بعد ما نغطي هذا الشيء بعدين نحكي عن ال non clinical achievements، الأشياء اللي لها علاقة في الطب بس إنه مش clinical، زي مثلا research, audits, publications إذا في موجود. بعدين بشكل أو بآخر نحكي كيف كل هاي الأشياء is going to help you to get to your future. إيش you want to do in the future. I want to be مثلا a surgeon, I want to be an internist, respiratory medicine specialist. بتحكي كيف كل هاي الأمور راح تساعدك وكيف الجوب اللي أنت عمالك بتقدم عليها هلا راح تساعدك to achieve that goal.
I see. So, for example, I'll give an example. I always introduce myself as, well, I'm Tamer. I have, for example, graduated from Alexandria, or I did my training at Alexandria University. Following that, I did my internship. And as soon as I finished my internship, I applied for a license in the UK and I started my foundation years and finished my core training where I've entitled myself into the MRCS exam. And then afterwards, I've applied for my registrar post. So that's kind of the clinical bits of it and personal life. And then I say, well, in regards to publications, I've been actively publishing, let's say, X amount of papers, and I've been co-authoring and that and this, and I've been involved in audits or involved in quality improvement projects. And then I move on to discuss about non-clinical. So I like swimming, for example, and I've won, for example, second place in swimming. And I also like cycling. How would I take my leadership experience towards that post, or whatever I've got from experience to the post that I'm applying for? So I think that's kind of a sensible plan, which is the past, present, and how will you take it to the future posts that you are applying for. Never say, well, I am Tamer, I'm 29, I am. I don't think it's a marriage experience. It's rather than it has to be professional, and they want to see that you're professional, you're to the point, and within a minute or so you can introduce your whole kind of life quite professionally. وهذا دايما بيبقى icebreaker, I think, is just to see how he's responding to these questions. The other question is, take me through your CV. That's also kind of very common. Any idea how would you structure this?
Well, I would just go through the jobs I've been in one by one. I don't think I would go into too much detail, but sometimes if that what they're looking for, they would ask you after. So in one of my interviews, they told me, okay, so you did your internship 2 months in surgery. What did that entail? What were you responsible for? And I would detail, like, I would put in cannulas, I would order bloods, I would review bloods, I would, pre-op, post-op care. So don't put too much detail when you're talking about it, but if they do ask, be prepared, know how to say it.
I see. And I think it's quite sensible to run through the structure of your CV just to highlight the points that you want to make in that particular experience. And that's just, again, an icebreaker, just to see if you have a structure in your mind. Are you able to conduct it, and whether you can show your enthusiasm throughout that structure. So I think that leads us to the second point, which is usually the interview goes, whether it's training job or non-training jobs, so trust grade jobs, they usually want to see that you're clinically sound and safe. And the way they do this is by giving, of course, some clinical scenarios. And most of the scenarios are based on the specialty you will be applying for. So if, let's say, general surgery, most common would be sepsis, hypovolemic shock, bleeding. If it's medicine, then it has to be something related to medicine, upper GI bleeding, or sepsis again, because they are quite hot in sepsis. So let's say, for example, we have a sepsis scenario, a patient who's coming with tachycardia, high temperature, let's say an abscess of some sort. How would you kind of describe your clinical management towards that?
So I think the two most important things in any clinical scenario is to show them that you have an approach. First thing, like, I would go A, B, C, D, E to assess the patient, the state, and along the way, what would you do if any of them is deranged? And the second
What
thing,
do you mean by A, B, C, D?
it's the assessment. We start with airway, breathing, circulation, and each one has a few things that we have to check. So airway, is the patient speaking? If not, is there something blocking the airway? If yes, what would you do? And then breathing, respiratory rate, SpO2. If you listen to the heart sounds, tracheal deviation, just a general assessment, basically.
I see. So it's kind of following the ALS or ATLS or CRISP, whatever protocol that you have in your mind.
The algorithm.
I see.
And the second most important thing is that you know when to ask for help. So they do want to know that you would ask for senior advice if you're not qualified enough to do something, or if you're worried about the patient. So just know that it's very, very important to say, okay, I'll ask my registrar, or I'll ask my consultant if you're a registrar, if you're applying for a registrar job. Just know when to ask for help, and they want to know that you're safe. They don't really want you to know what the diagnosis is or what you will do specifically, but they want to know that you're safe and you have a differential in your mind and you know what's going on.
Yeah, I think that's knowing your limitations and when to escalate is very important. So I've put some bullet points in here. So first of all, make sure that you're following some sort of a structure. Show that your mind is thinking and think loudly. So say, oh, well, I will go and assist the patient if it's an A&E accidents and emergency or on the ward. Make sure the airways, breathing, circulation, patient is stable or not. And then afterwards, move on to some kind of disability. Make sure you measure the glucose, do ECG, take some bloods, give some IV fluids, be gentle to the patient, give them some oxygen if they need it. And then afterwards, of course, you would go into assessing further the clinical bits of it. So you go to the secondary survey, let's say assessing what's happening, and then you would, by that time, you have your ABGs or VBG, and you have some results back. And let's say the patient's got an abscess, so you know that this patient needs to go to theaters, and that's causing the sepsis, but you can't delay the sepsis, which is within 1 hour. You'd need to have the antibiotics running through, and the catheter, the fluids, take the bloods, all these things that they call here in the UK sepsis 6. And then, of course, because you know the definitive management is drainage of that abscess, then your limitation would be to discuss with the registrar if you're an SHO, or talk to theaters, organize it with the patient, speak to the patient, to the family, to the nursing staff, so that they are aware. And you need to document everything. After you escalated everything to your seniors, you prepare the patient for theaters. Don't forget the group and save and the cross matching, etc., etc. So yeah, it's just really following the protocols, isn't it? And making sure that you're safe, your patient is in a safe place, and you're assessing the patient according to your level. And then once you've reached your limitation, simply putting, you will be escalating it to your next senior. If you're a registrar, then as you said, to the consultant, etc., etc. And then you organize all the logistics around it, whether it's ITU, registrar, cardiology registrar to review, or whoever needs from other specialties, as well as get the patient involved in that discussion. And make sure that at the end you say, I will actually document everything, and I'll make sure that all my orders are kind of verbalized to the teamwork, so that you're showing some sort of a teamwork approach in there. And that would be most of the clinical scenarios. If you look at Oxford Handbook or any guidance, NICE guidelines, it follows the similar protocol. Make the patient stable and carry on with your assessment. And again, here, assessment, it's not your diagnosis. You may be able to diagnose, but it's better for you to have a wider diagnosis, because a differential diagnosis at the beginning. And then as you go through the scenario, if they want to titrate you towards, let's say, oh, the patient's got ARDS, they will show you a chest X-ray, they will show you an ECG, if he's got an MI, etc., etc., and know your differentials. So that's pretty good. So I think that would be usually the big chunk of the interview, where people start feeling a bit of out of their comfort zone, especially when they are assessing, and you have 5 minutes per case. For example, in core surgical training, when I had it, it was just 5 minutes per case, and it was 2 cases. For core medical training, when I applied as well, it was 3 scenarios, each one 4 minutes. And then when I applied for one of the trust grade jobs back then, when I just applied for my GMC registration, I think it was 2 scenarios, one about AAA rupture, and another one was about types of shock. And that was 5 minutes, followed by another 5 minutes. And it's a heated discussion, because 5 minutes is really nothing. So you need to be really prepared and on top of it when you are dealing with it. Whether it's a Skype interview, because I think now it's mostly going to be Skype interview, or
Microsoft Teams.
Or Microsoft Teams, so virtual interviews, from my understanding. But they are still going ahead with the clinical scenarios.
In my case, the job I have now, it was a patient that has PE after surgery, and I had to assess that.
And so what's PE? Just to clarify.
Pulmonary embolism.
Okay, yeah. So a patient, yeah.
And he was short of breath. I had to do all the assessments, and I applied for multiple jobs. So another interview, I was applying for a respiratory and geriatric post. So I had an asthma case, and then I had an elderly fall case, and I had to assess and find out why the old lady fell down and all that stuff. Yeah. So it will depend on what the post is. And in some cases, they don't only ask you about clinical scenario, they can also have an ethical scenario, and ask you what would you do in that case.
Yeah, especially in regards to consenting. For example, Gillick competence, so consenting children who are 16, they are just on the verge of becoming adults. That's in surgery, at least. In
Mm.
medicine, I think they quite like the dolls and the privation of liberty. And when would you do the best interest for the patient in treatment? And when would you do the DNA CPR, which is do not resuscitate? And how would you discuss that? And assessing mental capacity. So yeah, that's these bits. I think they are very important when they look at them during the interviews. Cool. So next, I think the third bullet point to discuss today is the clinical governance.
The clinical governance.
Yeah,
It's a very big part of the UK system, I feel.
I feel so. Yeah, yeah, they like it. I think UK, Canadian. There's a little bit in the Australian, New Zealand. I'm not sure about the US. In the US, I think they have quality of service and researching, so they are more into those. But yeah, how would you kind of what experience have you had in this kind of uh,
Me
no,
myself, I haven't really been asked in interviews, and that's one thing to note is that sometimes you don't have all of these components in your interview, but you have to be prepared for all of them.
yeah,
But from my friends' experiences, they would ask them what clinical governance is as a definition, and then what this the difference between an audit and research and a quality improvement project, and you would have to know all the definitions for those. And
yeah.
if you have done something in any of these, you would give examples and elaborate on your projects.
Yeah, so I think the most important just to know what is clinical governance. اللي هو بالعربي أظن الحوكمة الإكلينيكية, which means how to govern the clinical setting or environment to make it the best or as best as you can up to the standards of a certain country, يعني للستاندرds تاع دولة معينة. It's quite hard sometimes to understand بالذات إنه here for example the standard is like NICE guidelines أو الستاندرد تاع البروتوكول تاع المستشفى. So that's how you would define it. And there are the 7 pillars of it. I thought I'll just switch on it and mention them. بحبوا يسألوهم بالذات لو it's a training post that you're applying for. It has to be part of your things so that they know that you, in your training process, you will get to do them. So the 7 pillars are clinical effectiveness, which is during your clinical rotation بتعمل الأشياء المطلوبة منك ولا لأ. Researching and audit. So if you're publishing researches, articles, are involved in projects, is the whole hospital involved in these kind of projects? Audits, of course, which is a quality improvement project against a standard معين, and there are different types of audits, and there are service provision audits as well to see if the service is met in that given hospital. There's risk management. Of course, this is very important in areas like now COVID and how to manage the PPE and all the risks, etc., which is a big now echoing around, especially during COVID times. Education and training, that's part of your clinical governance as well, that you have continuous education as you grow and training. So you go attend the courses, you have all the CBDs, you're doing all the online courses, you're doing all the trainings that are mandatory by the trust. And then, of course, patient involvement, which is openness. The trust has to be open. وكلمة trust يعني المستشفى هنا then it's a bit of trustees. How patient is involved, how the doctors and the nurses are open towards telling the patient the honest and truth about their management. Of course, IT and information governance. طبعا الآن بيحاولوا يحوسبوا كل شيء أو كل شيء محوسب. So there is a lot of data security and IT information that needs to be added onto the clinical governance. وآخر شيء هو human resources اللي هو staff management and well-being of the staff. وهدول هم 7 pillars that they usually ask during any interview. What are the 7 pillars of your clinical governance? And you'd go and tell them around those areas. They may stop you at one of them and tell us, oh, tell us about one of the audits you've done and how did you implement it in your clinical setting, or how you've done research or publications or your PhD, and how did you use that PhD in your clinical environment. Great. So that's kind of a little bit on clinical governance. Then there is usually a station about leadership and management. In my case, we had in my core surgical training, they've asked us to do a 3-minute
presentation, and it had to be 3 minutes. So they'll assess your time management on leadership and management. Show us an example of leadership and management during your medical school, and how did that affect your quality as a leader, and how will you take those towards your specialty training. And it has to be pre-prepared. So they gave us, I think, 3 days before the interview, you prepare it, and then in the interview they tell you, okay, so have you prepared your presentation? Yes. And they put a clock and they see if you do it in 3 minutes and how you go around it. Most importantly, just to know what's the difference between being leadership and management. So they ask us if a bulb is broken, is that leadership or management? Of course, that's management of the ward. Whereas leadership, somebody who's got a vision, and he's following that vision by putting a plan, implementing, and adding, of course, people, involving the seniors, involving other people, being a good team player and a listener, and then taking that project forwards to being accomplished and successfully published or arranged. Or, for example, the product of that project is vivid, and then of course there is a feedback loop about it. So those are all the qualities that they look for the leadership. And management, of course, just how to manage the patients on a day-to-day basis. Anything you'd add on those?
Well, in my experience, I was applying for non-training jobs. So in each trust, there are values for the trust, and some of them include leadership and management, but some of them could also have other things like honesty and care and excellence. So one of the things they could ask you is, how would you show excellence in your work, or how would you show honesty in your work? And you have to have a prepared scenario for what you would say. For example, let's say honesty. So for example, you've had this situation where you missed something in the labs, and therefore the patient wasn't given the best possible management. So in that case, you have to be honest with the patient and let them know you've made a mistake, but this is what we'll do to fix it, and we're moving forward from it in that way. And
Yeah.
you always have to give the patient the complete story, and give them the option of what to do.
Yes, to apologize and then be open to the patient and relatives, which they call it the duty of candor, in one way or another. And that's a question that they really like to ask. Do you know what's the duty of candor? And you have to explain that it's being open to the patient, explaining what happened. Let's say if you've done the wrong operation or something, and that takes us to something else, something we call a never event. They usually ask about. Any idea what's that, Natalie? I know it might be a bit of a difficult question.
It's a mistake that should never ever happen. But when it does happen, it has to be reported, and it's a major issue.
Yeah. Yeah, so for example, if you're doing a right leg amputation for a patient and you end up doing the left one, that's a never event. For example, giving a
Blood
drug
transfusion.
or blood transfusion, yes, to the patients, that's a never event. As well as, for example, giving, let's say, penicillin-based antibiotics to a patient who's allergic and gets an anaphylaxis shock, that's also a never event. So, and that's the difference between never event and near miss, something that could have happened but patient didn't go into any harm. So simply putting, what they're looking at is how safe are you towards the patients, and you need to prove and show that you are vigilantly and actively thinking about your patient's safety.
And that if something goes wrong, you're responsible enough to actually do something about it.
Exactly, yes. So that's also leads us to something else, trust values. You know, there is some, especially the trust grade jobs, بالذات اللي non-training jobs بيحبوا يسألوا, do you know anything about the trust values that you are applying for? How would you kind of think about this question?
Well, first step is to Google the trust values, the trust you're applying to, and find out what they are. And also, the same way as before, just keep in mind the scenario as an example. If they ask you to give an example, you can have a story to tell them.
Exactly. So each trust has got some values, وهذه القيم زي مثلا respectful, patient safety, or patient oriented, staff well-being. Yeah. and for example, no bullying. And those are 4 values of X trust or Y trust, yeah? And then they can ask you, have you ever had an encounter with a colleague where you had to escalate it because of bullying or because of patient safety issues, and then you have to kind of discuss this, especially with the communication skills, etc., etc. So I think that's something just to bear in mind, especially when doing interviews. Just read what's your trust values, read the personal specifications and what they exactly want from you as a job role. That takes us to the last point before we kind of wrap up and discuss everything. Show interest at the end. They can ask you, have you got any questions for that post, or do you have any further queries in regard to that post? How would you go around this question?
So first of all, before the interview, think about what you want from this job. For example, do you want to increase your medical knowledge? Do you want to increase your publications? Is there something specific you want to learn? And ask them if they would provide that.
Yeah.
So in one of my interviews, I asked if there will be lectures for me to teach me, and if I would have the opportunity to teach other people to improve my teaching. And in another job, I asked about opportunities of research. Will I get to do this? Will I only be in the wards? They like to see that you're interested and that you want to improve.
Yeah.
So use that as a way to actually show them your interest.
Sure. So that's a way of course, showing and that you have read the post and you just want to show that you are interested in that post particularly. So medical interviews in a nutshell is not that hard. It's just how to play, of course, the game and how to answer each question specifically, as we said. And it's usually built up around these things. سواء كانت a training job, whether you've applied over Oriel على training job, أو it was a job that is a trust grade job, يعني non-training job. Usually they look into these. Training jobs usually they were originally stations. حاليا عشان COVID they are mostly based on your CV وشوية stations حيعملوها ك virtual. I really recommend the book, and I always kind of I think everybody here in the UK they like this book just to read. Yeah, this one.
Yeah,
exactly. And I think that this one is available on Amazon. And I left a copy in Gaza as well, as I told you earlier on. And anyone can get it. And it's got all the logistics around the ethical bits. If your colleague comes back from, comes every day late to work, or if the consultant is drunk, or how to manage these scenarios, as well as clinical scenarios and leadership in management. So in a nutshell, I think from today's discussion, and the interview is structured around these things. It starts with just knowing a little bit about you, then knowing your clinical scenarios and how to structure them in a mannered way, a systematic way, and show that you're safe and your patient safety is the most important, and how you manage the complications if you can. And then you'd move into clinical governance. That's your third station. واعرف كل الاشياء عن clinical governance وايش الريسيرش وايش الاوديت وايش الفرق ما بينهم. You can read it even on Google. It's all there. And then the leadership, trust, values, and management. And what's the difference? And they sometimes can give you a presentation to present, and they can ask you, so what leadership qualities do you have, or why should we pick you? We'll go into that question at the end. And then at the very last, of course, they can ask about your surgical skills. لو كان surgery, medical skills, لو أنت medicine, what evidence do you have of it? طبعا إحنا كلنا عندنا log books. لو كان surgeons طبعا بالنسبة للمedics, they have also their own logbook for all the procedures that they do. اسم البوك medical interviews للي بيسأل for CTST, and it's available on Amazon, I think. It's by ISC, this one, just to show you. Okay, so, and then of course at the end you wrap it up and you show interest. And throughout your interview, your tone, the way you're talking is very important. Don't show that you're nervous, don't show that you're eager. Body language should be relaxed. You're talking slowly, each point by point. That's a very important thing. The other thing is, yeah, if they ask you for the trust grade job, why should we pick you particularly? How would you go around it, Natalie?
So I would say, from the values they're looking for and from reading the description for the job itself, I would use that. So if they're looking for someone who doesn't really care about the hours of work and would be committed, so I would say I am a committed person. I like my job. I don't really care if I'm the last one to go home. I care about my patients. I always try to improve myself so I can give the best care possible. Just things like that to show that you will fulfill their needs in that post.
Yeah, so it's a buy sell. So it's how to sell yourself. Simply putting, as you said, you want to show يعني تبين that you are applicable and you're safe. So you'd say, well, I'm a very, for example, friendly person. I like being involved in teamwork. Very into the clinical bits. I'm into learning, teaching. I hope that during this post, I will be able to contribute in teaching and gain in knowledge. So you're showing the mutual agreement between you and whoever is employing you. Also, you can show that I'm an active, for example, researcher. I like publications. I hope, and my hopes are, for example, during this post, I will be able to get involved into research projects and carry on them successfully. If you want to show your leadership and management, then I'm innovative. I have developed an application on the app phone or a startup, and I'm very into technology, etc., etc. So you can always show your good things around.
And I would say always avoid rehearsed answers. So show them that you don't have you didn't read something and memorized it and said it. Just showed your personality through it. And I would say sometimes even depending on the interviewers, if you can put in some jokes and if you just show them that you're a lively person, that would be good to work with. Yeah. Because you'll be with them all the time. So show them that you would be a good person to be around.
They look for somebody who will be fitting into their team, simply putting. Especially if it's a trust grade job, it's likely that they will end up for a long period. If it's a training job, they want somebody who will end up being a registrar or consultant that suits into that environment as well. Some questions are always tricky, like give us an example of bad communication skills that you have encountered, or tell us about an incident that you've been involved in. And here you need to be very kind of political and diplomatic in your answers, so that you're not affecting anyone. And at the same time, you may say that I haven't encountered such thing, but for example, I've seen a scenario of miscommunication. For example, during my ATLS course, initially when we started adapting to a new environment, understanding the ABCs of ATLS, and when we started the scenarios, we didn't know the team members. All of them were from different places of the world. We didn't communicate, simply putting, easily at the beginning, and we were having problems with managing that patient in that course. But following, of course, that scenario, we agreed that we will have a leader and we will have a time tracker and we will have somebody on the airway, breathing, circulation, etc. And we've reorganized ourselves in that course so that in the next scenario, we will win the best possible outcome. And here I learned how very important it is to pre-plan, for example. And this is a very swift and very soft kind of area where it's in a course, you're in a learning environment, and it wasn't something that is big fault. It's something that you're learning through. You're meeting new people, of course. In the first 2 hours, you want to huddle and start a team, which is quite cool, way of showing that you are able to communicate and start.
I feel like these type of questions, especially the ones that show us your weakness or what is your weak points, they're not really looking for you to tell them what you did wrong. They're more like more likely to be looking for how you overcame that.
Yeah.
So, okay, fine. One time I had a miscommunication with a patient. I explained the wrong way to take the medication, but from that, I learned to double check everything before I talk to the patient, and also make sure the patient understood what I was saying. And in that way, I haven't made that mistake again. So just show them what you did to overcome the error or the.
So yeah, they see that if you're auditing yourself continuous and you're conscious and you're effective and you're reflecting on what you've done as a practice, as an individual or as a team or as an organization. And this is very important, I think, in any practice in medicine, because this is how we slowly learn and slowly improve ourselves towards being better. Well, at the end, I think we've wrapped up most of the things and the highlights of each one of these bullet points. If anyone has got any questions, they may type it or write it down for the next 3 minutes or so. Otherwise, of course, I hope that we've covered most of the things for all of the people who were asking. لأنه مؤخرا كتير ناس كانت تسألني على الانترفيوز، كذا واحد خلص بلاب 2 واجالهم job offer, and I think it would be sensible just to have this video for anyone in the near future who will be passing their PLABs or applying for core medical or surgical training or obs and gynae or ophthalmology or whatever specialty of their choice. So I hope that this was kind of comprehensive. Anything to add on, Dr. Marsuga?
If you have any feedback as well, let us know what else you would like to know about how we did in this live stream.
There's a question here says, how about medical research? I think it depends. If the post is for an MD or PhD, then you have to show that you've been involved in some kind of research. For medicine or medical specialties, they like to see, of course, involvement in research. So you'd mention it. So I always say that I have X publications, I've co-authored in this, and it successfully was published as part of our team. So in research, you can show a lot of things, in fact. Research on its own, it shows how you're a leader, how you can manage teams, you're part of a team, and you're successful in carrying that project to an end product, which is being published. That's the end product, isn't it? And that publication actually made a difference to the clinical practice. And how, so let's say I've published in ophthalmology, I remember, when I was fifth year medical student. Everybody was asking, is it relevant to discuss it when I'm applying for general and vascular surgery? Of course it's relevant, because now when I'm doing my research articles, I always say the first day I started learning about research, it was by data collecting, and then I slowly understood how to write a paper, and then I started reading on basic statistics, and currently it's all kind of built up from that very first point. So without that ignition, I wouldn't have been in that situation that I'm now.
And if they ask you about it and you don't have publications or research, like my case is, I always show interest in it. So I say I helped people in their research projects, and I helped with data collection, with data analysis, but I haven't maybe found the thing I'm passionate about to do research about. But I have been interested in the basics of research, and I do have plans for the future to do research. So just show your interest.
Yeah, and always they like to ask about 5-year plan and 10-year plan. That is a very common question. What's your 5-year plan? What's your 10-year plan? And it's always nice to say that these things up front when they ask, tell us about yourself, which you've mentioned, which is the future.
Mm-hmm.
So, for example, in 5 years' time, I see myself as a competent registrar or as resident or specialist, where I am at the level of, for example, almost approaching a consultant level. At that point, I'd love to get involved into a PhD or MD or some research project, where in the next 10 years, like 5 years, so that's a 10-year plan, I would have finalized my all competencies as a consultant in X specialty, and I have by that time gained my PhD thesis, and I'm involved actively in teams around the world and researching some sort of something that you like. Let's say atherosclerosis or something about, CK kinine or something like that. So it's very nice to have a vision. It's not necessarily something that you will definitely do, but it's at least a vision of showing that you are on the track of some sort of a planning process that you're doing.
I think especially for non-training jobs, when they ask that question, they're looking for two things. There's first seeing how this job would fit into your plan. So if you would actually be committed to it and it would help you in the future. And second thing, they want to see if you understand what the structure of the medical training in the UK is. So if you say, I want to be a consultant in 5 years, they know that you don't really understand that you have to do 2 years of core training and then go into specialty and you would still be a registrar. So that's what they look for when they ask that question.
Yeah, of course. Oh, there was a question about coding. Coding is very important and nice if you know how to code, and that, of course, will give you an advantage in your interviews. Usually, publications per se, they are mentioned in your CV, so fee portfolio section. Apart from all this, that's only in the interviews. Pre-interview, there is an application, and in that application, you fill in all the points, and one of the points will be research. وحيسأل طبعا what researches have you published, and you'd say I've published this and that and then, and they will score you on that, and that will be your shortlisting criteria. So for example, in ophthalmology, I think they weigh them. So كل article you are weighted by 0.5 or something like that. In surgery, it's up to 7 articles. Then you get the full point, which is 5 points in the application. So that's where they look at it. And then in the interview, you may be asked around it. So that's where your research experience comes into applying for residency or specialty training. Any other further questions? During the residency itself, we have, yes. So somebody's asking about the residency. During the residency, or we call it here the specialty training, we have a requirement to publish at least once per year, or to publish throughout the training itself up to 3 first author or 2 first author in order for you to finish your requirements. And there's a curriculum that you can all access online and you can have a look at it. Cool. I think that's pretty much it for today. I hope that we were beneficial in a way, and we've discussed and elaborated on the structures of the interviews and highlighted some of the important bits of it and how to actively prepare for them. I wish for all of the people who've got interview coming up the best. Inshallah, they will ace it. And for those who are applying for jobs, whether in the UK, in the US, anywhere in the world, good luck for you all. I wish you that this year, inshallah, will be a good year for all, and a safe and sound year full of achievements, inshallah. Anything else from your side, Dr. Mazuka?
Just good luck for everyone, and inshallah, this year will be better than the last one.
Inshallah. Inshallah. All right. Take care, all of you. And thank you very much for joining us, Dr. Mazuka. Enjoy your holidays and have a good evening, inshallah.
Inshallah.
Salam.
Salam.